Hello, Kent County. I'm Dr. Adam London, Director of the Kent County Health Department. Today I want to give you a little update on the numbers and some breaking news about Pfizer and the vaccine for the 5 through 11-year-olds. So as of October 6th, here in Kent County, we're seeing an average of 266 new diagnosed cases per day. That's a little bit higher than the last update. We continue to see these numbers slowly increase here in Kent County, not at the same rate at previous waves that we had earlier this year and late last year, but still increasing a little bit, which is concerning. The good news we heard this morning is that nationally, overall, numbers are starting to come down. Now, we're not seeing that yet here in Kent County, but remember, the wave in cases in the southern states began about a month earlier than our wave here in the Midwest. So I am optimistic that we're going to see these numbers come back down before too much longer. But right now, we're still seeing a slight increase, so please be aware of that. Our positivity rate has also gone up a little bit. We're at 13.8% of tests here in Kent County coming back positive. A few weeks ago, we were at 11%. During the 4th of July, when our numbers were the lowest, we were down below 2%. So we do continue to see numbers increase a little bit. That's concerning, but it's certainly reassuring that we're not seeing the rapid increases that we saw previously. I think largely that is due to vaccination and immunity in our community. Deaths, we're at 857 deaths reported to us due to COVID-19 so far. And right now, sadly, we're seeing 1.9 new COVID-19 deaths per day. So that's come up a little bit as well. It's not surprising that bump in deaths usually follows an increase in cases by a few weeks. So we do have a number of people who are hospitalized right now here in Kent County. We have 182 persons altogether who are hospitalized with COVID-19 here in our Kent County hospitals. 47 of those individuals are in intensive care. So let's keep them in our thoughts and prayers. As it relates to children, we've had some people say that the children aren't really affected by COVID-19, or the kids who are hospitalized, they're usually hospitalized for something else. Well, I checked on that with the leaders of our Helen DeVos Children's Hospital here in Grand Rapids, and as of yesterday, they had 12 children hospitalized who were positive for COVID-19. 2 of those 12 were there primarily for some other reason, and they happened to have COVID-19. 10 of those 12 were hospitalized because of their COVID-19 illness, and 3 of those 10 are actually in ICU right now. So COVID is affecting our kids as well. It's affecting everyone in the community. The good news is that vaccine does work. It works in reducing the risk of infection, of hospitalization, of illness and death. And what we saw statewide between August 23rd and September 21st, we saw 45 vaccinated persons in the state of Michigan died of COVID-19. But 247 unvaccinated persons died during that same time frame. So while breakthrough infection does happen, it usually happens to a much greater degree in those people who are unvaccinated. So please get vaccinated. It reduces your risk of getting sick to begin with. It also significantly reduces your risk of serious illness, hospitalization, and death. Now, the good news that we heard this morning from Pfizer is they have turned in their data to the FDA. They are requesting approval for use of their Pfizer vaccine for kids aged 5 through 11. The FDA has that and is scheduling a hearing to review that data later this month. Hopefully, they will report out an approval from that, an emergency use authorization coming from that. Once we have that emergency use authorization in place, and once that vaccine is available to those younger kids, 60 days after that's approved and it's available to those younger people, 60 days afterwards, our order requiring the use of facial coverings for the pre-K through 6th graders here in Kent County schools, that order will expire. That 60-day period of time is to give an opportunity for those families who choose to get their kids vaccinated, time to do that, to get the first dose, the second dose, and to have some time on the backside of that to allow for that vaccine to take effect. So we are very optimistic right now that by the end of this calendar year, that order will be rescinded, and then we can move forward without orders in place. And that's really where we want to get. We want to get to a place where we know COVID is going to be with us forever, but where we can manage it through health education, and we can manage it by empowering people with the tools they need to protect their health without having excessive risk of it spilling over and affecting others in the community. So that's all for today. I encourage you to please get vaccinated, do what you can to make it difficult for this virus to spread. It is still a serious problem. And get that flu shot too. We want people to protect themselves from influenza as well. Thank you and have a great day.